Hello everyone. So today we will talk about AMH. So AMH is something where everybody is asking why AMH is important in the present day, where the infertility rate is increasing. So what is AMH exactly? So today I'm going to brief you about the AMH, the importance of AMH and its testing, and why it is so important in present day in the case of infertility. So AMH is anti-Mullerian hormone. This is a glycoprotein hormone. So what does it do? It helps us to know the egg reserve in the women. So normally what happens, the AMH starts declining at the menopause. So AMH is a hormone which is generated, which help in the folliculogenesis. It will help in the recruitment of the follicles. But AMH is not the one single factor which helps us to tell that the woman is not able to conceive. So normally the AMH level what we see is between 2.5 to 5.5. So anti-Mullerian hormone will come to know, that is the eggs which are there in our body. So normally when a woman attends her menarche, the total number of eggs which is available for the ovulation is almost around 450 to 500 eggs. That is at the age of 13 years. So as in every cycle, each egg is released. So once the eggs are start getting released, so the AMH starts getting declined. So for example, when the woman comes to us at 25 to 30 years, so we could say that her AMH is somewhere around 2.5 to 5. So as the age advances, that is about 35 when she comes to us, and when we do the AMH, then we see the levels are somewhere between 1.5 to 2. Then above 40, the AMH level is somewhere around 1 to 1.5. So what does it help us to know is whether the fertility rate, that is, in case if we start with the treatment, how good the patient can conceive and how faster the patient can conceive. So AMH also helps us in present day, that because it is almost coming down, because we are seeing many of the girls attending early puberty. That is, normally 10 years back we used to see the girls used to attend puberty at the age of 12 or 13 years, but present day we are seeing the girls attending early puberty at the age of 10 years or 8 years as well. So when the girl attends her puberty at the age of 8 years or 10 years, automatically the egg starts declining. So when the same girl comes to us at the age of 25 to 30 years, we see that her AMH level is almost dropped down. What do expected, like around 2.5 or 3, it would have come down to 1.5. So in the present trend, we are seeing the AMH decline at the age of 25. So this helps in the girls who are planning to conceive in the later phase. That is, if they want to postpone their pregnancy, like after 30 years or 35 years, this AMH test will help in the egg freezing. Like if they want to freeze the eggs and then plan their pregnancy, or they want to conceive immediately, or they plan the pregnancy immediately, AMH is the best test in knowing the egg reserve. But only single AMH cannot determine the fertility. So exactly just by AMH we cannot say that the girl cannot conceive or she will conceive or whatever the prognostics, because AMH is not a single factor. So we will take, along with this, we will do a scanning. We do an ultrasound scan where we see the egg, that is, we see the antral follicle count. So the number of antral follicle count correlates with the AMH. So for an example, if a woman antral follicle is somewhere around 8 to 10 plus, the AMH we will be seeing somewhere around 4 to 5. So if 8 to 10 follicles with AMH 4 to 4.5, then the women fertility rate and the egg is fantastic. The conceiving rate is almost around 35 to 40% in the first cycle. Suppose if the atrial follicle count is somewhere around 5 to 6 and the AMH what we expect is somewhere around 1.5 to 2, and this is an alarming sign where the woman has to plan a pregnancy in the next 6 months of 1 year for a natural conception or plan for an egg freezing, because this helps us to determine how fast the woman can conceive. So AMH also can be declined in many reasons, in present day lifestyle factors, that we see many women are lacking with their physical activity. So many of them are into a sedentary lifestyle, that is, they do less of exercises, less of everything. So only the sedentary lifestyle, that is sitting job, is more nowadays. So when the sitting job is more, the abdominal obesity ratio increases, that is we call as the obesity hip ratio. So once that increases, the levels of the hormones changes, and automatically the AMH level comes down, that is the egg reserve comes down. So when the egg reserve comes down, then the quality of the eggs also will deteriorate, and the conceiving rate declines for the every cycle. So that's the reason AMH is an important factor to know, present way to determine whether the patient can conceive, how fast, and secondly whether it can be a natural pregnancy, or whether we have to induce the patient further to get a better egg revex, or we have to plan for an IVF pregnancy. Any further doubts, you can contact your nearby gynecologist or to me, to Shiva Krupa Polyclinic, Basveshnagar. Thank you.